Well, good evening, everyone, and thank you for joining the Voice of Lupus Foundation as we begin our 4-week webinar educational series entitled There is Us in Lupus, Take Charge. You know, having an unpredictable and debilitating disease like lupus can be challenging and oftentimes overwhelming. As president of the Voice of Lupus Foundation and as a lupus warrior myself, I created this educational series to connect people with lupus to important resources that can help them learn skills that they'll need to manage everyday life with this disease. Our new 4-week webinar series will feature various medical doctors in Trinidad and Tobago who will provide tips, coping strategies to help you manage lupus and its everyday challenges, as well as bring to you resources that will empower you to take charge over your health and wellness. I am your host, Rihanna Harilal, and at the Voice of Lupus Foundation, we have always been here to offer our support to lupus patients all across Trinidad and Tobago. And today we are absolutely thrilled to tell you about today's session as we discuss lupus and the eyes. So I pretty up my eyes today, because I'm stuck in an apartment in the US and I wanted to look good for you. So I hope I did a good job. Just wanted to lift my spirit and also to let you know that, even though you're going through things in life, you don't have to look like what you're going through, and I think that is in itself is a therapy. So enough about me. We are discussing, I hope I pronounced this right, ophthalmology, which is the branch of medicine concerned with the study and treatment of disorders and diseases of the eyes. Now, we know that having systemic lupus is a chronic autoimmune disease that can affect any part of the body, including the eyes. And lupus most often affects the heart, joints, skin, lungs, blood vessels, kidneys, the central nervous system. And, the clinical course is unpredictable and is, characterized by periods of remissions and flares. Some of them might be acute or chronic, right? Now, the effects of lupus may have in or around the eyes include changes in the skin of the eyelids, dry eyes, inflammation, things like that. Now, I'm not going to continue because we have the expert in the house. And of course, I really am happy to, introduce this woman of faith, this woman of purpose, this woman who has, been through so much and yet has been able to be a blessing to so many persons through her service and, her willing to give. She gives so much. And facilitating this session is the talented and, the very beautiful, very talented, wonderful person I consider a friend, Dr. Deborah Bartholomew. Dr. Bartholomew wears many hats. She is an avid advocate for diabetes and autism. She has spoken on the former's effects on the eyes on local media, as well as in different parts of the country in conjunction with the Diabetes Association of Trinidad and Tobago. And she's a medical doctor with special interest in ophthalmology. So, Dr. Bartholomew, thank you for being here, and the floor is yours.
Thank you so much, Rihanna. I have to say that when Rihanna called me, anytime she calls me, I know it's for the Voice of Lupus, but I, regardless of what I'm doing, I say yes, because Rihanna and I met at the launch. Well, we met before that when but she hired our band. Yes, I used to sing in a band to perform at the launch of the Voice of Lupus in 2012 it was.
Yes, 2012, yes.
And we have not looked back since. Yes, I consider her to be a dear friend, and I'm one of her silent champions because she has certainly taught me a lot. Not just about lupus, in terms of, because as a medic you can be very detached from what is happening with your patient, and she's taught me a lot about the journey And she's a very, I said to somebody yesterday, I said, she is a woman of tenacity and resilience. That's what I said.
Thank you very much. Means a lot
and
coming
that
from
is the
you.
truth.
Thank you.
That is the truth. So thank you very much for asking me. I am very honored, as always, to be a part in any way and associated with the Voice of Lupus. And certainly this is quite commendable. The series is quite commendable because it's important. And I think education is the best way to empowering someone and arming them with the know-how of how to not just how to carry the burden of the disease, but also how to help manage it. You know, and the more they know, the better, I think. And the more empowered they are. And certainly if they don't know, then you know they at least you can give them some information that they can ask questions at their next doctor's visit. So
very much so.
I commend you for the series.
Yes, thank you very much. And before you start, I just, persons are joining, and I just want to encourage them. Listen, we're asking persons, to mute your mics so that Dr. Bartholomew will not get distracted with the feedback. Sometimes we have environmental feedbacks in the background, as well as if you have questions, please send them. We are live on Facebook, and we are also in the chat. You can send your questions, and then after, we will have some time to field and address those questions. So Dr. Bartholomew, it's yours.
Thank you. So I'm going to share my screen now so that you don't always have to look at this face, right?
That's a beautiful face to look at. What's your problem?
Right, so let's see. Right, there we go. Right, so you are seeing the screen, right? The eyes have it is what I entitled my talk.
I think you may have, is there a possibility of making it a little bigger? Can you put it on full screen or
it is on full screen.
It's on full
is
screen?
It too
okay.
Small?
On my end, it's a little small, but guys, can you all see? Most importantly, you all can see?
Yes, we can see it.
Okay, good. All right.
I can make it bigger.
Okay.
Which means I might have to make the rest of the slides bigger, but it's okay.
Oh my, okay.
That's okay. That's okay. That's an easy fix. Right. So, I had to include one of my paintings, Lupus and the Eyes, and
oh, that's nice.
I thought that this was an apt painting to include because, actually, this painting, the skin of the eyes, the eyelids, actually was painted to mimic sand. Wow. And certainly with lupus, the skin around the eyes, the skin of the eyelids and the skin around the eyes can become really, really dry.
Right.
So when I actually saw this painting, I thought, oh, how fitting that I can put this in as part of the presentation.
Right.
So how does lupus affect the eyes? Well, first let's talk about lupus, the disease. What is lupus? So Rihanna actually went in quite a bit into what lupus is, and lupus is an autoimmune disease. It's a chronic autoimmune disease where the body produces autoantibodies to antigens within the cells, within throughout the body, and these immune complexes. So the autoantibodies bind to the antigens, and the immune complexes result in tissue injury and inflammation because there's also a drive of other cells to come in and produce inflammatory mediators, and so you have a lot of damage to cells and to tissues as well. And here you can see this is basically telling you what happens. So you have genetic factors, you have environmental factors, and these affect the B cells and T cells, which are the ones that are immune mediated cells. And so you have the autoantibodies and you have the inflammatory, what we call pro-inflammatory molecules that they result in tissue injury. And the parts of the body that are generally affected by lupus: the eyes, the skin, lungs, the central nervous system. You can get nasal and oral ulcers, you get inflammation of the heart, you can get blood disorders, of course, arthritis, vasculitis, and muscle changes as well, and kidney damage. So now let's talk about the eyes. And first we go into the anatomy of the eye so that you're able to appreciate where exactly lupus can affect the eyes. And what we do is we go from the outside and go all the way back. So if you look at the top left, you will see, up here you will see the eyelids protecting, and the eyelids closed to protect the cornea, which is what we call the baby of the eye in the Caribbean. And this white part here is called the sclera. That's important, and we'll talk about why that's important later on. And the lids, and you can see, if you look at this picture, you can see the cornea and you can see the sclera. You can see that it's glistening a bit, and that's because there is a layer of tears. And it's important to see that this is a tear duct here, but up here is where the tears, for the tear gland, the lacrimal gland, is all the way up in the corner here, and tears form and come down into the inferior fornix, and when you blink, the upper lid pulls the tears from up here across the surface of the eye, and then tears drain into the tear duct. And from front to back, you can see the cornea and sclera are actually one. The cornea is clear, the sclera is opaque, it's white. The lens, that's another important part. This part here is called the anterior chamber, and that's the space between the iris, which is the colored part of the eye, and the cornea. The lens, which is the focusing part of the eye, the vitreous, which is usually clear, and the retina. And in the retina, you can see on this side, you can see that they're blood vessels. Okay, they're blood vessels that come up underneath the retina. This is the choroid here, so they're blood vessels underneath here, and they're also blood vessels that run along the retina. And that is really important, because when we come to talk about how lupus affects the back of the eye, we talk about these blood vessels in particular. Of importance, this is the optic nerve. So all the nerve fibers of the retina join up to form. I usually say I usually call the nerve fibers the hairs on your head, and the optic nerve is like a ponytail, and it gathers up all the nerve fiber layer of all the nerve fibers of the retina, and they join up to form the optic nerve. And the optic nerve, if you think of your eye as a camera, the lens in the eye is like the lens in the camera, and the retina is like the film in the camera, and your brain is the processing center. And long ago, when we used to take, and we still do sometimes, so some people still do it, we take pictures to the center to be developed. The optic nerve is what facilitates that. So the optic nerve is basically you taking the pictures to be developed by the brain. Okay. Any questions so far?
So far, so good.
Okay, good. So how does lupus affect the eyes? And Rihanna actually, when we talked about what she wanted me to talk about, one of the things that she was really clear about was that she wanted to know, she wanted me to include medication and how medication that is used to treat lupus can affect the eyes. So lupus affects the eyes via two major pathways: via the disease process itself, and via the medication used to treat or manage the disease. Now, damage due to the disease process involves changes to the skin around the eyelids, and we talked about that, dry eyes, inflammation of the white outer layer of the eyeball, that is the sclera, blood vessel changes in the retina. So remember, we talked about those blood vessels that lie on the retina, and the nerve, damage to the nerves controlling eye movement and affecting vision. So this is just a diagram, and I'll show you some more pictures, but this is just a lumped all the ways that the eyes can be affected. It's just lumped up into this one picture. Dry eye disease, eyelid disease, retinal disease, nerve disease, and scleral disease. Okay, and I'll show you another picture like this, but I just want you to just bear in mind these pictures. Yeah. So the skin around the eyes. It's mostly, you don't always see it in systemic lupus, but you tend to see it a lot in discoid lupus or cutaneous, what we call cutaneous lupus. The skin has a rash that is reddish, raised, scaly, but not necessarily well defined. Okay. Sometimes there are no symptoms, it's just a rash that appears. So sometimes, because it's so dry, you can get burning and itching. But because it's a rash because of vasculitis or inflammation of the blood vessels, you can get deformities taking place, because what vasculitis does is it decreases the oxygen flow to the tissue. So the actual skin can become scarred and deformed, okay? There may also be episodes of swelling of the eyelids. And actually, if you have recurrent swelling of the eyelids for no reason, sometimes, and over a period of time, you may actually have to consider lupus. So the rash is made up, as I said, of scaly, disc-shaped lesions. It mostly appears in the areas that receive sun. So typically, what we tell people who have discoid lupus is that they should wear sunblock or try as much as possible to limit their solar exposure or sun exposure. Exposure to cigarette smoke or even secondhand smoke may also play a role. Sometimes the condition occurs independent of lupus. 10% of people who have discoid lupus, we know will go on to develop systemic lupus. And usually when you have this rash, it responds to steroid treatment. So this is this swelling, this is the eyelid swelling that you tend to see in lupus. And this is the rash starting to appear. And you can see how red and scaly the lids are here. And these pictures here show you the edge of the lids, how scaly and inflamed. See that? It's very dry. And now it's healed. And see how, now that it's healed, if you look, you can see a few lashes, but when it's healed, see that some of the lashes are gone even, okay? And what you're also seeing is that there's some deformity in the lid, okay? So it's really important to pick up this early rather than late, because what happens is that you also can get destruction. There are glands that come out that come out between the lashes here, and these glands produce oil, and that oil forms a nice layer over the tears. So if you remember that experiment when we were younger, and you were given a glass of water, and then you were given a glass of water, and you were asked to pour oil, and the oil sits on top of the water, and then you go back after a few days or after a day, and you look to see which glass has more water in it, or which glass the water has evaporated, and you know that the glass that has more oil or has oil is the one that stays at the same level or has barely evaporated, whereas the other glass with no oil has evaporated quite a bit. And that's actually how our tear film is. We are actually made with oily glands to prevent our tears from drying out too fast. So here, what you can see is that this inflamed area at the edge of the lid, and oh gosh, you can see that this lid is already starting to become deformed, but at the edge of the lid where the inflammation is, because it's so inflamed, these glands become destroyed, or they can become blocked. And if they're not working, this can actually contribute to dry eyes. So this in itself, so you can have dry eyes for another reason, but this in itself can also contribute to dry eyes. And so we come to dry eyes now. Now, dry eyes, as I said, can be as a result of the inflammation of the edge of the lids, what we call blepharitis. It can be because of the rash that you get from discoid lupus, but also you can get dry eyes for another reason. And there's a condition that you can develop in lupus called Sjogren's syndrome, which is where the gland, remember we had talked about, let me see if I can go back to that slide. Remember we had looked at the anatomy and we said that the lacrimal gland, the gland that makes tears, is up in the corner here, right? And that gland can become destroyed by lupus, okay? So Sjogren's is a condition in which the tear glands don't produce enough tears to lubricate and nourish the eyes. The other moisture producing glands are similarly affected. Typical symptoms, if you think about it, your tear film is supposed to lubricate your eyes. So if you think about something think of a joint that is supposed to be rubbing. If you put your one hand into the next, and if you put some cream in both your hands and rub it and feel how it glides, okay? And then if you have no cream, how it feels, dry and rough, right? So the same thing. Typical symptoms are irritated, gritty, scratching or burning eyes, a feeling of something in the eyes. So you tend to feel like people tend to say that there's gravel in the eyes. And because you feel as if you have gravel in the eyes. Now, there are two types of tears that we produce. We produce basal tears, which lubricate our eyes and exchange oxygen and take away waste and exchange oxygen across the corneal surface. But we also produce reflex tears, and reflex tears are produced when we cry and when we have something has gone into the eye. That's the way it works. So if you have a sensation of gravel in the eyes, or gritty sensation, or foreign body sensation, the eyes can actually tear. You can have a watery eye, and people tend to think that you're going crazy when they say to you, "But my eyes are always watering," and you say, "Well, it's because your eyes are dry," and you're like, "What is she talking about? She doesn't know what she's talking about." But it's because your eyes are actually dry and are stimulating reflex tears. If you have really severe Sjogren's though, you won't even produce much reflex tears or any at all. And the other thing that you will have or will experience is blurred vision. The blurred vision may be intermittent. It can come and go. So if you blink, you may actually see better, and then your vision becomes blurred again. And that's because the first thing that you are supposed to, that the light hits, when it hits the eye, is the tear film. So if the tear film is deficient, your vision is going to be blurred, okay? Advanced cases of dry eyes may result in damage to the front surface of the eye and impaired vision. And that's because the cornea needs tears to nourish it and to remove waste. But also, when there's not enough tears, the cornea starts to become what we call keratinized. It starts to get hard, okay, and starts to become opaque. The dry eye that is seen in lupus can't be distinguished from other dry eye conditions. So sometimes patients present with dry eyes, and it's a while before you figure out that it's because of lupus. Do I have any questions up till now?
Not on my end. Anyone else? Do you have any questions for Dr. Bartholomew? I know on Facebook, on the live, many patients are commenting that they have serious dried eye
My eyes.
problems. Yeah. Another patient said her doctor actually stopped her from using hydroxychloroquine because her eyes started showing severe damage after 2 years being
Right.
on
So we're
medication.
definitely going to get to the hydroxychloroquine. Um, I wonder if I should then mention treatment for dry eyes now.
Yes, yes,
Uh,
if you can.
so, of course, the most common way to treat dry eyes and the easiest way to treat dry eyes is just to replace the lubricants. So, what I recommend now remember we said that there are two types of ways in which the eyes are affected um, by lupus. One is the destruction of those oily glands, what we call the meibomian glands, and one is the destruction of the lacrimal gland. So when there's a lacrimal gland destruction, which is you're not producing any tears or enough tears, you must use lubricants regularly. And those lubricants, I would say at least 6 times for the day. Some people need to use it more often. We don't get much preservative-free drops in the Caribbean. Usually you have to buy it online or buy it in the US. Preservative-free is better because preservatives can also cause irritation. Without much tears there, you don't have a buffer for the preservatives, so you can get even more severe irritation. You don't produce any tears at night, so you definitely need to use something that's a little bit more viscous at night. Sometimes you may need to use something that's viscous during the day as well. So there are ointments that you can use at night, and what I usually recommend for nighttime is an ointment that is oily based, so it does not dry out. Okay. But the ointment at night is really important. Sometimes when the eyes are really dry, and even putting in drops every hour doesn't help, we advocate for what we call a punctal plug, which is we use a little piece of silicone or collagen. So the collagen ones actually dissolve over a period of time. The silicone ones don't. And we put it into usually the lower punctum. And let me go back to that slide. So right where it says here tear duct, we put a punctal plug right here, and that actually blocks about 70 to 80% of the tears. Okay. And if that doesn't suffice, then we put one in at the top as well. And sometimes we have to advocate for permanent punctal occlusion, depending on how severe the dry eyes, how severe your eyes are. So that basically, in a nutshell, is how you would manage dry eyes. Now, scleritis. Now, we talked about the sclera, and we said that the sclera is the white portion here. You see the white portion in this young lady's eyes. So scleritis is inflammation of the sclera. Okay, so when you have itis, it means inflammation. So scleritis is inflammation of the sclera. It is extremely painful. So it's a painful red eye condition caused by inflammation in the white or scleral outer layer of the eye. It occurs in approximately 1% of people with lupus, and sometimes is the first sign of the disease. And when you have scleritis, it must be investigated. You can have now, remember in our anatomy slide, the sclera goes, this is sclera here, from this part here, going all the way back. So you can have anterior scleritis, which affects here, and you can have posterior. See, this is the sclera going all the way back. So you can have anterior scleritis affecting the anterior portion of the sclera, and you can have posterior scleritis. Okay? Both of them cause eye pain that can feel like a deep, severe ache. Usually what the patient describes as a boring pain in the eye or in the sockets. You may also feel tenderness in your eye, along with pain that goes from your eye to your jaw, your face, or your head. And you may have blurred vision, unexplained tears, or notice that your eyes are especially sensitive to light. Anterior scleritis also may make the white of your eye look red, and you may see small bumps. Though that is called nodular scleritis, but it's still scleritis. With posterior scleritis, you usually can't see that, but you still have the pain. Okay? So these are pictures of scleritis. And you see this is the bump that I was talking about. The thing with scleritis is that if you look, you will see that it's the deeper. There are two layers here. There's the upper, there's what we call the episclera, which means like epidermis, above. Epidermis is above the dermis. So episclera is the tissues above the sclera. But if you look closely, you will see that it's the deep blood vessels, because these are the tiny vessels on top here. And it's the deep blood vessels that are dilated and inflamed. So this is not an episcleritis, but an actual scleritis, nodular scleritis. And this bump here, you can see it's actually coming from the white part of the eye. And this is what it tends to look like. You see all the blood vessels are very dilated. So it's a little bit different to conjunctivitis, because conjunctivitis gives you a pink eye, because the deep blood vessels aren't dilated. But with a scleritis, the deeper blood vessels are all dilated. So it's more like a bright red or a deep red eye. And what happens over time is that because of the scleritis, the sclera becomes, because of the inflammation that's taking place also in the blood vessels, the sclera also becomes weak and thin. And what you see is the underlying, so this is what a condition called scleromalacia, meaning that the underlying tissues have become very thin. Okay, and this is potentially sight threatening. Yeah. Well, the next part of the eyes that can be affected by and I'll get back to scleritis in a bit, because we'll talk about the management of scleritis. And I think, let's just see if I may have put my slide in a different place. Hold on one second. Okay. So retinal vascular lesions, and when I say vascular lesions, just like with the rest of the body, where you have what we call vasculitis, which is this is one of the ways in which, and a actually serious way that lupus affects the body, is the vasculitis. And that's how you can get clots and in different parts of the body. And that's because it's inflammation of the small blood vessels. So in the retina, the presence of these lesions actually correlate with active disease. So you won't get vasculitis or see retinal vasculitis in active SLE. And the blood vessel changes are due to a lack of adequate blood supply to the retina, and may cause decreased vision ranging from mild to severe. For individuals with severe retinal vasculitis, the prognosis is poor. And that's because the retina becomes what we call ischemic. And sometimes what you see is, and ischemic means that there's decreased oxygen. And what you see is new blood vessels starting to form. And those new blood vessels can bleed, they can break, they can bleed, they can cause blindness. They can also they grow with fibrous tissue, and when the fibrous tissue contracts, it can pull on the retina and cause a retinal detachment. So when you have severe retinal vasculitis, the prognosis is not good at all. retinal vein occlusions and retinal artery occlusions have been reported, but these are rare. And the choroid, which is the underlying area that has a lot of blood vessels, that is sits right underneath the retina and nourishes the outer third of the retina. It can also be affected, but this is uncommon. And what you see is excess fluid, and you can also get detachments. But lupus choroidal disease correlates with blood vessel disease in the rest of the body, just like I was talking about vasculitis. So, and it may be also related to kidney disease, which, as we know, is a serious complication of lupus. Now, the nerve damage, we talked about, what we did talk about was the nerves. We talked about the optic nerve, right? I showed you optic nerve. But one of the other things that I didn't mention was the nerves that control the movements of the eye. And one of the nerves that is affected mostly by lupus is the third nerve, the third cranial nerve, which is the third nerve that comes out from the brain. Now, the first nerve that comes out from the brain is the optic nerve, which is the nerve that takes the pictures from the eye straight to the brain to be developed. But the oculomotor nerve, or the third cranial nerve, is responsible for turning the eye in, up, okay, in, up, and as well for raising the eyelid. Okay, it's also responsible for constricting the pupil. So if you look at the gentleman in the picture here, he has a cranial nerve 3 palsy, which means that the blood supply to that nerve has become affected. And so the third nerve is not working. So we said that it is responsible for turning the eye in. So therefore his eye is now turned out. It's responsible for lifting the eye up. So raising the eye up. So the eye is now pointing down and out. And it's also responsible for lifting the eyelid. So this eyelid is droopy. And it's responsible for constricting the pupil. So this pupil is dilated. Okay, so that is what we call a third nerve. And you see the causes, vasculitic. And vasculitic means diabetes, high blood pressure, but also lupus. Okay, so cranial nerve palsies can result in double vision. And if you look at it, the reason why you would have double vision is because one eye is focusing on one direction and the other eye is focusing in another direction. Okay, poor eye movement and alignment. So the eyes are misaligned. Poor pupil reflexes, as you can see, this is not reacting to light, and droopy eyelids. This is what you call a droopy eyelid. The other thing is lupus optic neuropathy, which means that the optic nerve is affected, and the optic nerve can be affected in several ways. But usually it is, again, the blood flow to the optic nerve that is damaged. And it doesn't happen, it's quite uncommon, but what you end up with is slow progressive vision loss, okay? But you can also have impaired color vision. So what we usually do is we do a test for red desaturation. So we compare you looking at something, a red object in one eye as compared to the other eye. And what you tend to see is that one eye, the eye that's affected, the red looks washed out, okay? Damage to visual nerve fibers in the brain may also cause hallucination, but also loss of peripheral vision and or central vision. So that's why it's important to do field tests as well, because you will not be able to appreciate when your peripheral vision is gone. So these are ways in which lupus affects the optic nerve and as well the nerves controlling eye movements. So we come back to this picture again. The dry eye, see the dry eye, the eye is red. The retinal vascular lesion, so from vasculitis, the optic nerve damage, the lesions that we said that take place on the skin, scleritis. I didn't mention infections, but of course, in lupus, your immune system is all, excuse me, used up. So you are prone to developing infections, as well as because you're on steroids. Steroids dampen your immune response, so you are at risk of getting infections. Any questions so far?
Yes, Doc. There are a few questions in the chat there. One person is asking about the conditions that you've highlighted there. Can they be caught on early and treated?
Yes. So let's go back to scleritis, and this is why a talk like this is important, because you see, some of us might say, gosh, my eyes hurting me, yes, but I could see, okay, and you don't do anything. You don't go to the doctor, you don't have it checked. So it's important. The most important thing is you being aware of the symptoms. Caught early, it can be treated and arrested, okay? The mainstay of treatment with scleritis is initially what we call non-steroidal anti-inflammatories. So mild scleritis is treated with non-steroidal anti-inflammatories, like ibuprofen, but not quite ibuprofen, something that's a little bit stronger. And sometimes you may need to use steroids because it's an inflammatory process. Similarly with vasculitis. So the same way that you would treat a vasculitis throughout the body, you would treat the same way in the retina. But there are other things that we can do in the retina to treat it. So when you have decreased blood flow in the back of the eye and new blood vessels start to grow, there are treatments that we can do as ophthalmologists that will target the decrease in oxygen. So what you do is, in the back of the eye, and I think of a seesaw. Think of a seesaw. So this seesaw, think of you and your friend, okay? And your friend is the same, when you were younger, your friend is the same size as you, same weight as you, okay? So you're both balancing back and forth. But if, for instance, you have two friends on one end, you are oxygen supply, and your two friends are oxygen demand. They are now going to outstrip you. So it's going to teeter over onto their side. And so when that happens, new blood vessels start to grow. New blood vessels, as we said, can break and bleed very easily. So what happens is, in what we do, if you notice floaters, sometimes you may notice a floater in the eye.
Oh yes, I have plenty of those.
Floaters or flashing lights. Those are signs. Floaters can be signs of bleeding, or it can be a sign of a retinal detachment, a floater and flashing lights, because the retina is being pulled, okay? But anytime you notice floaters or flashing lights, you have to be seen right away. And it could be an early sign, a telltale sign of bleeding at the back of the eye, or of serious pathology at the back of the eye that needs treatment. Now, if we notice anything like that, what we can do is we can give you injections to decrease so what the injections do is they actually try to decrease the need for new blood vessels, and similarly laser does that as well, okay? So those are two ways to treat early rather than late. Late is not good where the back of the eye is concerned. And we spoke about dry eyes already. Yeah?
Yes.
Now, with regard to nerve damage, you may not notice it until it's late. But what happens is that it can resolve over time. Okay? It can get better over time. Optic nerve damage, that doesn't get better. So, and unfortunately, it's the lupus that needs to be under control. Okay? I'm not sure if I'm explaining that properly. But it's the lupus that needs, but what you would experience is blurred vision. Okay? And once you, as a patient with lupus, if you do have blurred vision, you have to be seen right away, because there's so many different things that can cause blurred vision. You saw all the different things that we went through, and almost every single one of them said blurred vision, even dry eyes. So as a lupus patient, if you have blurred vision, you must be seen right away.
There is a question that was sent privately from a lupus patient asking if, I hope I pronounce this correctly, is it ptosis?
Ptosis.
Right. Is that a disease that affects lupus patients specifically?
Right. So remember this. Do you remember this picture?
Yes.
Yes. So this is ptosis. This lid droopy here, that is what we call a ptosis.
Okay.
So it's a third nerve palsy, and yes, lupus patients can get the cranial nerve that they can get the most involvement is third nerve. So they get a third nerve palsy, which is a droopy eyelid. The eye may turn out and down, and the pupil may dilate. So yes, ptosis is one of the, but the ptosis can resolve.
It can resolve.
Yes, so it can resolve, and there are ways in which you can that we tend to deal with this. But if you have a palsy, it's possible that it may not, but usually it resolves.
Can nerve damage and optic neuropathy be caught on early?
Yes, okay. It can, which is why it's important to be investigated, to be examined regularly when you have lupus. Right. But it's not that common. It's important to know that it's not that common. Yeah.
Okay. I just have a question personally. I noticed that I get a lot of my eyelids and the nerves around my eyes always twitching. Is that something worth talking to my doctor about?
Well, for more than one reason. Twitching can be for several reasons, but usually twitching is because you're squinting. So you may actually be having blurred vision. Mm-hmm. And your blurred vision may just be refractive, which is just a change in you need glasses. But
I wear glasses, but I notice it depends on it depends on like my stress levels and the top of my eyelids and it would just,
because you tend to squint when you tend to squint when you're stressed, but you don't realize.
Right.
It depends on the amount of work that you do, especially if you do a lot of night work, and if you drink a lot of caffeine.
Yes.
You will also have twitchy eyelids.
Yes. Coffee is life sometimes.
but if you squint the eyes, and you see, this is why what you just said, it might seem as something minuscule to you, but you may be getting light sensitive because the eyes are dry.
Right.
And because when you are light sensitive, you squint. Think about it when you're driving. If you wear shades, you won't squint.
Yes.
But you squint because you're trying to protect the eyes from the sunlight.
Right.
So it might be that your eyes are actually also dry.
Mm-hmm.
You know,
a lupus patient said she was told that she blinks a lot. Is that a problem or is that common?
Say that again.
A lupus patient messaged via Facebook saying that she was told that she blinks a lot. Is that common as well?
Yes, because your eyes are probably dry. You see, remember we talked about when I showed that picture of the anatomy of the eye, and I showed how tears are spread across the surface of the eye. Remember, tears aren't spread across the surface of the eye from the lacrimal gland. It's actually the top lid touching the what we call the tail lake that sits in the base of the bottom, that sits within the bottom lid. So it if you look into the mirror, you will actually see a layer of tears that sits just above the edge of your bottom lid. That's called the tail lake. And the top lid actually touches the bottom lid and pulls the tears up over the surface of the eye. That's how the tears are spread. If your eyes, if your tears actually dry out in 10 seconds. If you're not producing sufficient tears, okay, you're going to, that might actually make you want to blink more because the eyes are going to be gritty and sore. If you are having issues with the glands actually not producing enough oil, then your tears are actually going to dry out faster. And we actually test for that. Okay, so these are reasons why you may be blinking more. And so definitely you may need to see your doctor because it may simply be because of dry eyes. Yeah.
Okay.
I didn't quite get, how can ptosis be resolved?
Usually the ptosis can resolve on its own. That's the first thing. But remember that a ptosis is a palsy. So basically it's the nerve that's no longer working. Do you understand that?
Yeah, so is it therapy or?
So therapy doesn't necessarily help. And so sometimes you need to have surgery to repair the ptosis. Okay? But it's a tricky kind of operation because it's because of nerve supply that's not no longer working. Yeah.
Okay. I'm just asking because my mom has it.
Mm-hmm.
She doesn't have lupus, but I have lupus, and I noticed that it's happening to me.
Right.
So I'm a bit concerned about it. But hers is really, really bad.
Right.
Mine is just starting.
So what the first thing that you need to do is make sure that you don't have dry eyes. That's the first thing.
Well, I think I have that too.
Yeah, because the ptosis can actually be a reactive ptosis because of how dry your eyes are. You understand that? Right.
Yes.
So the first thing we need to do is treat that. If you are having a ptosis though, then that needs to be investigated, and because you need to make sure that you're not having any vasculitic lesions within the brain, yeah, or along the, yeah. So that would need to be further investigated by your ophthalmologist and managed jointly between your ophthalmologist and the doctor who's managing your lupus.
Okay, and just a question, since I'm in Tobago, do you have a suggestion?
Can I just interject? Doc, is it possible that we can just have you finish the presentation and then the questions?
Yes.
Okay, so sorry guys, didn't mean to just butt in there rudely, but also for persons who are interjecting, can you just please identify yourselves? And of course, we're going to field the questions after the presentation. Thank you.
Right. So let's move on to the adverse effects of medication. And I think a lot of people, especially in light of COVID, a lot of people were hearing them bandying about just using COVID, using hydroxychloroquine like if it was dinner mint, right? I myself was quite I don't even have the right word to describe it. I would say flummoxed by the fact that people have been using hydroxychloroquine for years, some with effects, and so to hear people just talk about using COVID using I keep saying using COVID, using hydroxychloroquine because of COVID, I'll just take it like as if it's vitamins or something. It's a bit shocking. So let's talk a little bit about hydroxychloroquine. And in addition to some of the medications used in the treatment of lupus, these may have side effects. And hydroxychloroquine can cause retinal toxicity. And it's important, and we know this, once someone is being started on what we call Plaquenil or hydroxychloroquine, you are actually referred to the ophthalmologist for a baseline assessment. So you have your first assessment prior to starting hydroxychloroquine, and then every 6 months or so, every 6 months to a year. So annual comprehensive eye examinations are recommended by the American Optometric Association for people with lupus, especially for anyone taking Plaquenil. As a precaution, people treated with Plaquenil should get a baseline, this is what I was just saying, a baseline eye examination before or soon after starting the drug, and visit an eye doctor annually. Long-term Plaquenil users on high doses will need to monitor eye health regularly to prevent retinal toxicity from long-term use. Now, usually the long-term use of the side effects of Plaquenil that you see, what we call a bullseye maculopathy. So the macula, or the central part of the retina, is what is affected. Okay. Now, the reason why it's important to be monitored when you're on Plaquenil is because the effects of Plaquenil can be irreversible if it becomes serious. Okay. So they're up to a point, but when you start seeing bullseye maculopathy, it's actually irreversible. So it's important to be assessed regularly. The thing with Plaquenil is that it's above a certain dosage so the risk factors are above 6.5 if you've been using it for more than 5 years. If you're above the age of 60, if you have liver or kidney disease, because you can't break down the Plaquenil so as efficiently, so it stays around in your system longer. If you have underlying retinal disease or maculopathy already, so the macula is already sick, and so therefore it's less resistant to being damaged by Plaquenil. And if you have a daily dose above 6.5 milligrams per kilogram, which is what was actually also stated in the US and in the UK recently with the advent of COVID. Okay, so it's really important. It's really important to, as I said, to have a thorough eye examination, to have a field test, because the field test is, and I'll tell you why the field test is important. The field test does two things. One, if you have Plaquenil maculopathy, you will actually pick up either loss or decrease of peripheral vision or macular changes on your field test. But you will also pick up, and this was a question that Rihanna asked, you can also pick up enlargement of your blind spot, which you will notice if you have damage to your nerve, okay? Which is what we were talking about, the optic nerve. All right, so the field test is really important. The other thing that they would do is something called an OCT scan, which actually looks at the layers of the retina, and it will pick up any damage, okay? If they suspect that you are starting to get damage, you would be referred for what we call electrophysiology testing, which basically means that you are actually testing to see whether the nerves in the retina are putting out the right amount of impulses and the right magnitude of impulses. And but what happens with Plaquenil is that Plaquenil will actually dampen the magnitude of the electrical response by the nerves. So that's another way that it can be picked up early, if that's what you suspect, right? So so that is basically Plaquenil. But like I said, it's really important. Patients who are on Plaquenil for more than 5 years, it's rare to have toxicity less than 5 years, but more than 5 years, the risk of getting toxicity increases. So it's really important to have annual eye examinations and assessments, including the field test and the OCT. Okay, and the other medication I wanted to talk about was steroids, and you might think that steroids, I mean, that, you know, steroids, how will that affect the eye? But does anybody know the most common cause of what steroids do to the eyes most commonly? Anybody knows?
Is it glaucoma?
Yes, it can cause glaucoma. It can actually, if you use systemic steroids can actually put you at risk of getting glaucoma, but steroid drops can as well. Steroid drops actually put you more at risk of developing glaucoma. What else? More commonly than that, though.
Diabetes.
Yes, steroid put you at risk of developing diabetes. That's right. What
dry
else?
eyes. Dry eyes.
Yes, dry eyes. But what else?
Steroids is just the devil.
Is it cataract?
Cataracts. Steroids put you at risk of developing cataracts, right? So you develop a particular type of cataract, which is in the back part of the lens. It's not a typical senile cataract. And diabetics tend to develop this kind of cataract as well. It's called a posterior subcapsular cataract, which is the cataract that develops under the capsule of the lens. But it develops in the back part of the lens, and light actually enters through the cornea, passes through the pupil, and is focused really finely. So as it passes through the lens, the light rays become more and more focused, right? So the back part of it, if you think about it, if you have a cataract in the middle of the lens, light can still enter on the sides. If you have a cataract on the outsides of the lens, light can enter the middle. But if you have a cataract on the middle and the back, then your vision falls really rapidly. So blurred vision, again, you develop blurred vision rapidly, and posterior subcapsular cataracts, we tend to tell people we don't wait for it to mature. A long time ago you used to say, oh, wait for it to mature. No, because they can rob you of your vision quite rapidly because of where it sits in the lens. Okay, so that's another way that steroids can affect the eyes, and that's actually the most common. And so that is the end of my presentation on the way that lupus affects the eyes. Any questions?
Yeah, I know there are a lot of questions. So, who wants to go first? It's it's just a matter of you getting in the question. So I know Philo. Hi, Philo. It's really nice that you joined us. I know you were asking some questions prior. You can go ahead and finish what you were trying to get from Doctor.
Very much, but I think I pretty much got all the answers. I think my last one, I was just asking her for a suggestion on ophthalmologist in Tobago.
Oh, well, you you actually have Dr. Sharma, Rishi Sharma, in who works in the and Dr. Dorian Dwarka, who work in the hospital.
Okay.
So and that department actually is a pretty good department, because you have a full retinal service, because Dr. Sharma is a retinal surgeon. So and Dr. Dwarka, he does a lot of glaucoma surgery. So you have two good ophthalmologists there.
Well, thank you very much.
Doc, can you just provide me with the host privileges back?
Yes. How do I do that?
I think you have to click on my name, right click on it, and it should give you that option.
Right.
And there is someone who has lupus, and they're asking if lupus itself, systemic lupus, can cause blindness.
Yeah. I mean, that the.
To me, I think it's broad. That's a broad.
Yeah, I mean, going all the way back to. I mean, if you start with, so even dry eyes left untreated can actually cause corneal scarring. Scleritis can cause blindness. Retinal vascular conditions can cause blindness, and anterior ischemic optic neuropathy, which means that the anterior means in a forward part, so the front part of the optic nerve, but you can also get the back part of the optic nerve. So anytime the optic nerve is affected, think about it this way: your eye can still take pictures, but the brain can't receive it to be developed. So the eye is taking pictures, but the pictures aren't going back to the brain. And if the pictures aren't received in the brain, you can't see them, because the visual center is in the back part of the brain.
Yes. Okay.
So yes, SLE can cause blindness.
Can cause blindness. Someone wants to know, listen, I'm having problems with my vision again. Now I'm seeing blurry and can't make out certain things from a distance and up close. What should I do?
Well, I would say an optometrist first. Definitely, because you see, and I learned this with my son often. No, Rihanna, I'm trying to give you back host duties.
Mm-hmm.
I don't know what's happening just now. I try to right click. Let's see.
Okay.
Control.
Okay, I think I can do that. I think I'm reclaiming it here.
Right, yes, you did it.
All right.
Yes, so the question was blurred vision, right?
Yes.
Now, often we this happens with my son. You know, I remember him having I can't even remember what it was. It was a minor issue, and I was like, oh my goodness, it's because of the autism, and somebody said, no, it's because he's a boy and he's a teenager, and so often we forget that we are human first.
Yes.
So depending on this person's age, it might just simply be because they may be presbyopic, or you know, or passing a certain age, you know, and in the Caribbean, we tend to want to hold on to our vision. So we pride ourselves on looking at the screen all the way down the road, or you know, I've seen people with their font size, it's so huge that the person in the back of the maxi can read it. Right? So it might simply be something as simple as that, you know. So that would be the first thing that I would do. I would see my optometrist, because it can be so, and remember that optometrists are trained to also examine the back of your eye. Mm-hmm. They may not be able to dilate in Trinidad, but they can at least look and see if they see anything that's abnormal.
Right.
Now, if they do, they'll refer you. Yeah?
Right. And in terms of, coming back to these two crucial medications that a lot of us as lupus patients rely on, are there any other drugs that you are aware of that can also cause, some problems that are used specifically for lupus in the treatment and management of autoimmune diseases?
Well, the two main ones that lupus patients use are those.
Okay.
And like I said, I mean, I've been working in ophthalmology for a long time, and I have never seen bullseye maculopathy.
Yes.
I've never seen it.
Yes.
I mean, we've had a patient who complained of blurred vision, and we've done whatever and stuff. But you see it, you probably see it in online or in your textbooks or whatever. But I've never seen it. And if you do suspect that someone is having some changes, and you stop it for a while.
Yes. One of the reasons I really wanted you to zero in on that was that what I found is that a lot of patients, they don't want to use hydroxychloroquine. They don't want to use the medication because they're hearing that, it can lead to vision loss. It could lead to so many side effects affecting the eyes. And I think it's so important that there's a balance of information to really be out there for patients to make a very good choice, because some persons are just going on what others are saying, that it's going to lead to, vision loss, is going to lead to all these other complications without, participating in the...
That's right. That's right. But at the end of the day, think about the risk. So the risk of getting hydroxychloroquine toxicity in the retina. Think about the risk of what can happen to you because of your condition.
Yes.
And you have to weigh that out.
Yes.
And the same thing with steroids. I mean, I had steroids for a short period of time, and I absolutely hated it because it made me feel very old.
It made you feel old?
Yeah, because I had nightmares, but everybody's different, and so I wouldn't, if I definitely did have a condition where my life depended on taking medication, I would definitely, you wouldn't, I mean, it's chemotherapy.
Yes.
And so you have to weigh it out. But that said, like I said, I have never seen somebody with bullseye maculopathy. I've really seen it in the books, but never seen it in real. And I started working in eyes in 1998.
Oh.
And yes, and I had a 7-year hiatus. And that's about it. So I've been working in eyes for a long time. And,
my goodness, in 1998, I just went into secondary school.
Yes, I'm starting to show I'm showing my age. This year it was 25 years that I graduated from med school. So
wow.
But I hope nobody I know is seeing who I hope family know, but I'm talking about I don't want anybody to know that secret.
Oh my goodness.
but with regard to, I mean, my issue with the whole COVID and Plaquenil and stuff is that it was not a drug that is necessarily readily available.
Yes.
And there were way too many people who needed it, and there suddenly was a shortage, and I was not happy about that.
Yeah,
because
the global shortage. Yeah, it was really terrible.
That's right. And there were people who bought it up, and I'm talking about people who started calling. If do you know anyone who is coming in, or do you know anyone who has access, or do you know any companies? And I'm calling pharmacies, and they couldn't get it. So that was my issue with Plaquenil. But I mean, every single drug has side effects. So for instance, the NSAIDs that we talked about, and those NSAIDs are not what we call topical NSAIDs for mild scleritis. They're actually NSAIDs that you take by mouth, so oral NSAIDs. And we know that non-steroidal anti-inflammatories can actually affect your stomach badly, you know? So everything has side effects. Yeah.
Someone wants to know, is problems seeing in low light, example, while driving or at night, symptom of anything we discussed so far or might have touched on?
Yeah, what slide she said, oh, which slide did she want me to maximize? That's actually a symptom of cataract. So we touched on that last. But yeah, those are definitely symptoms of cataract. But you can also get it with dry eyes. I should point out. Remember, we talked about dry eyes and glare.
Yes.
So you can have glare problems because of dry eyes, right? So, but I would definitely have a check, because that problem seeing in low light might definitely be cataract.
Cataract, okay.
Yeah, cataracts tend to, what they do is, the best way to describe it is they tend to suck up all the light. So all you find is that you're seeing dimmer and dimmer. And the other thing is that they can scatter light, because if you look at this picture, so I'm going to have to share my screen again.
Yes, let me go ahead and do that. Hold on. Okay, here we go.
Right. So let me pull up that part. Yeah. So you see this, so what happens in the lens? So if you look at the lens, you will see that the lens, the fibers in the lens are running. I mean, you could just barely see it. I don't know if I can make it any bigger, but the fibers in the lens run in one direction only, okay? And that is to allow light to pass through and bend uniformly into the back of the eye. It's the same thing with the cornea. The cornea is clear because all the fibers in the cornea run uniformly. They're actually parallel. Same thing for the lens. What happens with a cataract is that the lens fibers start to run in different directions, so haphazardly. And because they're haphazard, they scatter light. So the light no longer bends into the eye uniformly. Sometimes it bends in, sometimes it bounces back out, sometimes it bounces to a different part. So everything is blurred, but also there's a lot of glare. And it's the scattering of the light that causes glare. But cataracts also suck up, they also suck up the light, passing into the eye. And that's probably why she has dim vision.
Is there a specific test for cataract? What is the name of the test?
Oh, the first thing that we do is we check your vision. Right. And so if your vision is reduced, it can be because of a cataract. And usually when the cataracts are pretty bad, your vision is reduced. So what 20/20 or 6/6 vision is what we call it. We use 6/6 in the US, or 20/20 in the UK and in the Caribbean. And that is perfect vision. So it means that something that is 20 yards away or 6 meters away, you see it 6 meters away. The top letter, the top E, you know that E at the top of the chart, the big one at the top of the chart, that is 20/200 or 660. It means that something that is 60 meters away or 200 yards away, you can only see it 6 meters away or 20 yards away. And that's what you get when you have cataracts. So it actually starts to decrease what we call your visual acuity. So that's the first test that will clue you into whether someone has a cataract or not. And then the other thing is, do you remember if you've ever taken a picture and you see what we call the red eye, or when you have, right? So the red eye is light passing from outside and actually bouncing off of your retina, and that reflection, so the red that you see is actually the retina reflecting through, okay? clear lens.
Okay.
Now, if you have a cataract, what happens is you see a dim red reflex, or you see black spots on your red reflex. Now, am I still on sharing? Or
Yes.
I stopped?
Yes, you still have rights, yeah?
Okay. All right, let me see if I can pull up. Right. Can you see that?
Not as yet.
Just now. Okay. So these are pictures of cataracts.
Okay, it's still saying sharing, so we're gonna
Still sharing.
Yeah. Right. Just opened up to your computer. All right, here we go.
Yes.
Oh, wow.
Yes. So these are pictures of cataracts.
Oh my.
It's gonna take a long time to load up, but okay. So these are pictures of cataracts. So look at this one where you actually see a white reflex.
Mm-hmm.
Yeah, and the red reflex here is dim, and that's because there's a cataract there. Okay, and these are different cataracts here as well. Okay, so that's what a cataract does. It changes. So those are pictures of pictures showing. I mean, some of them are pediatric, but basically, that's what you see with a cataract. This is the red. This is what we call the red reflex or the red eye. But when you have a cataract, the red reflex is dimmed, or you may see what we call an opacity against the red reflex.
Mm-hmm.
Yeah. So that's yeah.
In terms of steroid use, yeah, talking from personal experience, I've been on steroids for most of my life, and thank God I did not have any sort of major involvement with my eyes, no glaucoma, no cataract, or anything like that. However, what I've noticed as I have continued to grow old, and also my lupus continues to flare, I find that the dried eyes, as well as I mentioned the twitching, and also being diagnosed with other autoimmune diseases, like for instance IBS, the possibility of having celiac disease, things like that. I mean, we are discussing lupus, but there are so many other patients who develop other autoimmune diseases, yes. Right? Can you talk a little bit about, what are some of the natural things that we can do to keep our eyes safe, so to speak? Yeah. How to treat our eyes, how to take better care of our eyes?
Well, dry eyes, unfortunately, the syndrome of dry eyes is really common. It's I think the most common, or one of the most common ailments that patients will complain of. And sometimes you can't quite put your finger on it. But if you dismiss your patient, they will keep coming back, or they will go to somebody else. So it's a really common problem, and it's a problem. It's not something that, because you can be so symptomatic and uncomfortable.
Mm-hmm.
That said, it affects women more than men, unfortunately, yeah. Especially as we get older. Okay. Then you have the added thing of medication, even autoimmune disease, right? Because you have the dry eye, the dry mouth. So some of the things, and then the other thing is that we tend to spend a lot of time, like we are now, on the laptop or on the phone, and that kind of thing. Mm-hmm. So one of the things that we need to be mindful of is the length of time that we actually do spend on our laptops. Right. And I actually taught a group of young men, there is a 20. Now I know that we may not be able to sustain this, but as I call it the 20-10-10 rule, which is every 20 minutes you take a 10-second break and you blink 10 times, right?
Excuse
But that's a hard one to.
Nicole, just excuse you. Can you mute your mic, please?
Sure. Sorry.
Yes, that's okay. That's all right. Yeah, yes, Doc. This 20-10.
Yeah, 20-10-10 rule, which you every 20 minutes you take a 10-second break and you blink 10 times to help lubricate the eyes, and it you might be able to even do that even if you're not on the laptop and think about it. Your eyes tend to get drier as the day progresses, of course, and I mean, apart from, there's nothing that you can drink, take, to make you produce more tears. I know that people will say, and I remember my mom told me about DTP. At the time, we don't do those things anymore, and that's because they aren't. We know that putting plant material in the eye is not a good idea, right? So lubricants, and I'll tell you something. There are remedies that you can use. For instance, you can actually use petroleum jelly when you have nothing, because petroleum, all the ointments that we use at night are petroleum based.
Yes.
And so you could put petroleum jelly, because petroleum jelly is going to make sure that the moisture doesn't dry out. You're going to bed, so you can actually put petroleum jelly, and the petroleum jelly in itself is going to lubricate the skin around, right? Emollients also help, because remember, emollients replace moisture. So emollients also do help. Tea tree oil, it must be diluted, but tea tree oil, when you have a lot of buildup on the edge of the lid, remember that inflamed, that picture that we show where there was a lot of inflammation on the edge of the lid, and the glands weren't working very well. Yes. Tea tree oil is another thing that can work. So yes, there are natural remedies that you can use. Even standing in the shower and just allowing, especially if the lids aren't producing enough oil, and we're talking about oil, we're not talking about tears, but if the lids aren't producing enough oil, you can actually stand in the shower with warm water and just allow it to just rest on the eyelids to help stimulate the oil to be produced. So things like that, yeah, certainly.
I remember growing up having eye problems, and my granny would say, go outside and get the dew and put the dew in your eye. I mean, those things, growing up, there were so many sayings, there were so many things. I know I think it's one of those leaves, I can't remember the name of it, the wand of the world.
Wand of the world?
You warm it, and you warm it on the towel, warm it and you put it.
Now, wand of the world still works wonders in that once you don't get it inside of your eye, because you have to be really, really careful. I've seen some nasty fungal infections in the eye from putting plant material and that kind of thing. But Wonder the World still works wonders on, if you have an abscess, an area that is starting up. Excuse me, my throat is really dry.
That's fine. Guys, water break if you can.
How about cold cucumbers?
Huh?
How about cold cucumbers?
Cold cucumbers, yes, yeah, But when you need to stimulate the glands, when the glands are blocked and you need to stimulate them, heat is what works. Yeah,
not recommended.
Yeah. When you have the swelling, cold works. So remember that swelling, I think cold works. But when the glands definitely aren't functioning, heat is what works.
I like to dress up. I like to play with my makeup.
What makeup?
Yeah, because it helps with my self-confidence. It also helps because I don't like to look how I feel, like shit. Excuse my language. And I refuse to carry that, project that. I refuse to project illness, even though I feel like crap most of the time. Using makeup, some of us, and I'm guilty of this, sometimes you go out on a long assignment, you're tired, you're exhausted, you come back and you just crash and you fall asleep with the makeup. We have compromised immune systems and we are so susceptible of developing infections and stuff like that. Can you stress the importance of, hygiene?
Well, I mean, for everybody.
Yeah.
Last night I fell asleep in mine. So, so it was actually my sister, God rest her soul. A couple of years ago, I had a severe illness, and I was in ICU. I don't know if you remember. Yes. I was in HDU and ICU, and my sister started buying me those wipes. The wipes that you get in the packets.
Yes.
And to clean your face, and I've stopped using soaps, and actually she used them because she had a sensitivity to sunlight, and those were the only things that she could use.
The wipes.
Yeah, the wipes. So I mean, you can look and see which ones are good for you, and I actually suggest after that you use, seeing a dermatologist isn't a bad, or having a dermatologist as part of your team isn't a bad idea. But it's really important to clean the edge of the lashes, especially because I have seen people with using mascara, and it's mascara is the main one, mascara and eyeliner. I don't use eyeliner anymore, but and it can build up on the edge of the lashes and block the gland. So I just want to show you a picture of an eyelid. Let me see. Let's see if I can get a nice picture. And then what I'll do is I will let me get a nice judgment. The pictures are so okay, let's use this picture. Yes, that's a nice one. All right, so let's share again. Right. So can you see the eyelids?
Yes.
Yes. Right. So the picture to the right shows you the gland that I was talking about. See where the lashes are, and you see this gland here. It's called a meibomian gland. Now this is the tear film. This is what I was talking about, the tears. This is the tear film here. All right. Now this purple gland here produces oil. See, there's oil inside there. Okay. When it becomes blocked, this gland swells up and swells up and swells up. When we put on mascara, and you see where this is compared to that?
Yeah.
It's really close. So when we put on mascara and eyeliner, these glands can actually get blocked. And when they get blocked, you end up with with what we call a chalazion, or those bumps that you have underneath your lid. But also sometimes just this area is inflamed, and it prevents the oil from coming out, the sebum from coming out. And when that happens, the tears, because this sebum coats the tears. See, this is a yellow line over the tear film. It coats the tears. So when there's less of this, the eyes become more dry. So it's really important, even when you wear makeup, it's really, really important to clean around the eyes, because otherwise you will end up with chronic blepharitis. And you're already susceptible because of the lupus. You're a woman, so you're actually adding on top of, what is already taking place. Right. So you just make the dry eye problem worse. And like I said, dry eyes can be a real problem a really tough problem to manage.
Are there over the counter droplets that one can use, artificial?
All are over the counter.
Yes. Okay.
Yeah, all over the counter. There are different brands and there are different formulations. Each brand has a different formulation. There is Sustain Balance, which balances out the tear film. So if you have issues with what we call meibomian gland dysfunction, Sustain Balance is a good one. There's Refresh Optive, which is also a really good one for lubricating the eyes for over, especially if you're doing it 4-6 times a day, maybe even more than that. There's an ointment which we use at night called Acrylam, and that's because it's petroleum based. There's also Refresh Liquid Gel, which is a quite much more viscous than the other forms, because it lasts longer in the eye. There are so many different formulations, and it just depends. What I usually say is I can prescribe any amount of drops for you, but it's up to you to feel it out and see how your eyes feel when you use it. So some people you prescribe liquid gel and they hate it because it's so gungy. Some people love it because it actually makes the tears last longer. So it's always up to you to feel it out and see how you feel. But if you are using lubricating eye drops, be really careful of using drops that have something called nafazoline in it. So nafazoline is a vasoconstrictor, and all it does is constrict the blood vessels, but also it can cause you to develop some kind of dry eye at some point in time. So I tend to stay far away from it. Also, what we know about nafazoline is that after some time, it constricts your blood vessels, so the eyes get white, but after some time, it actually makes the blood vessels then dilate. And when they dilate, the eye gets redder. And so you don't realize, you think that your eyes are just, again, red. So you keep putting it in, but it's causing the problem. It's now causing the redness. So you have to be really careful with using drugs that have nafazoline in it. So I stay clear of those and use lubricants. So make sure they don't have nafazoline. If they have preservative in it, know that can cause an issue, and you may have to feel around and see which ones don't cause issues. And yeah, that, just if you find that you have to use drops more often than every hour, then you definitely need to see a doctor. 1, 2, you may need to use a formulation that is up in viscosity. So there are some that are like Refresh Tears and not Sustain Gel, but there's some tear formulations that are just like water. Yeah. They're literally really, really thin. So you may need to up the viscosity, and you might find that actually you're using less often of a drop. But if you're using something that's really viscous and you're still having problems, then you need some intervention.
Sure. Well, one of our patients, she has to leave. She sent a private message, and her message was really one of for you, that she thoroughly enjoyed it, very informative. You were so knowledgeable, and to note that you don't look your age, and your hair matches well with your background, and she was really happy that you would spend the quality time with us. So she's left.
Oh, I thank you very much. But if I tell you, today it was that one of my son's teachers met. When I saw him, he said to me, the person who came to pick up your son on Monday, was it your mom? And I said, yes. And he said, well, if you didn't tell me that, I would not believe you. Because she looks like your sister. So it's in the genes. It's in the genes.
Yes. Cheryl Ann, I know you have a question regarding what you have been experiencing, as well as Wendy. So you guys can feel free to chime in here, and just before Dr. Bartholomew has to go, just to get your questions in, because I know that you'll have some concerns.
Hi, good evening.
Hi.
Dr. Bartholomew.
Why you took off your camera? I want to see your face.
Hold on.
Right.
Yes, doctor. Why would a doctor refer one to do a multifocal ERG?
Right. So that is the electrophysiology testing that I told you about is what I was talking about. That is one of the tests when you're on Plaquenil, especially if you're on it for a long period of time. That is one of the tests that I was talking about, where Plaquenil will affect the magnitude of. Remember that the retina is made up of nerve fibers, right? So there are impulses that pass across voltage or electricity that passes across the retina, and so these tests actually measure the magnitude of the impulse of that voltage wave. And so therefore, if it's reduced in any way, then it means that the Plaquenil is actually maybe affecting the function of the retina, and they would actually advise that it's decreased or stopped. Yeah. So that is one of the tests.
Would they have picked up on something before they referred the patient to do that particular test, or is it just
it can't be. No, it really should be a routine test in that you probably do it first off, so you get a baseline, you understand, and then send you for future tests. But it's possible that they just want to be thorough. Okay. It's possible that you also may not have you never done it. If you've never done it, they probably just want a baseline, or they want to just make sure that it's not affecting the back of the eye. They just want to be thorough.
Okay.
Yeah.
Thank you.
Welcome.
Vindra, would you like to just ask your question instead of me just reading it? I think you should use the forum here to just introduce yourself and share.
Hi, good afternoon. You hear me?
Hi, yes.
Hi, this is Vindra speaking.
Hi.
Thanks a lot, Dr. Bartholomew and Rihanna, for the presentation so far. It's been very, very interesting and very, very informative. With respect to the dry eyes, I've been having dry eyes problem for almost 14 years now. I've been trying the Sustain Ultra Performance, but I don't know if it's like thick enough for me or what. So I still have that gravel feeling even after I use it. So I was wondering how you would know without using oil which one might be more viscous, which one might be more watery. Is there any way to tell?
Right. Now the ultra high performance should actually be pretty viscous. Okay. But how often do you have to use it?
Well, I don't use it very often. Sometimes maybe twice for the day. Should I use it more often?
Use it more often to start. But But even after that, then there's something called Refresh Liquid Gel that you can try. And what I usually recommend is that put the liquid gel first thing in the morning and put it in the evening, because it blurs your vision. But it also helps the tears, the lubricating eye drops that you use that aren't as viscous, it actually helps them to last longer.
All right.
Yeah.
Okay.
And so I wouldn't use the ointment, so like Lacrolube and Acrylam, I wouldn't use those in a day because it's petroleum based, they will blur your vision. So I would put those in just before bedtime.
Okay.
Yeah. But definitely try increasing the frequency of your drops. And if that doesn't work, then try using the liquid gel.
Refresh liquid gel.
Refresh liquid gel.
Right.
It has a purple writing on it, or purple part. There's purple on the label.
Okay.
It really does last a long time because it's quite viscous.
Okay.
So try it and see.
All right, thanks. One thing related to the question, I asked Rihanna first on the low light, right? The problem seeing in low light that's been going on almost for the same amount of time. The cataracts test, how exactly is that done though? Because I had a few tests done, but I'm not sure which might have been for cataracts. Because they always tell me with the low light.
It's a normal eye examination.
Okay.
Yeah. When was your last eye check?
December. I actually had an OCT and dilation done then too.
Right. And they didn't tell you that you had cataracts?
No, but they said they might have optic neuropathy and nerve damage.
Ah, okay.
Yeah.
Okay.
So that was the first one. So that was the baseline. So I have to go back next month to have a second one done.
Right. So that might actually be the reason that you're having issues with low light because of the neuropathy. Yeah. But definitely ask them. Have you seen any sign of cataract? Can you make sure that my eyes aren't overly, because all of that, the dryness, they should be checking as well.
Right.
I mean, that should be an important part of your assessment. So when you go in and you talk to them, say, listen, I've been dealing with dry eyes for over 14 years. It's really problematic, and I need to know if there's anything that you can do to help me. So definitely mention that. Okay.
Definitely will do. You mentioned earlier something about the red saturation test or something.
Yeah.
What's that saturation about? What was about? That's an eye test where they'll do something.
So when you had your test, did they cover one eye and let you look at a red? For instance, the top of a red the red cover of a bottle or anything?
No, nothing like that.
Never did that. Right. No. So that's part of an assessment for optic neuropathy, though.
Okay.
Yeah.
Yeah. Never did that one though. Okay.
Yeah, that is actually one of the simplest tests to do for optic neuropathy. So before we had OCTs, and you see a lot of people tend to get wrapped up in, and that's kind of why I'm glad I did medicine when I did medicine, because I learned from people who didn't have CT scans and OCTs and stuff. So I learned how to look at an optic nerve and say, listen, this looks like it might be glaucoma, this looks like X, Y, and Z, as opposed to, or it looks like it might be swollen or whatever, and then send you for an OCT, as opposed to somebody saying, oh, this OCT is, because these are tests that you did that were really simple and that actually clued you into whether there was an issue or not. And to be honest, a red saturation is the simplest test that whether your pupils are working or not. So they should shine a light into each eye to see if your pupils are working or not.
Right.
And that's all. So those two tests to tell you if you have optic neuropathy.
All right, I'll follow up with them. Thank you very much.
Welcome.
All right, we're happy to help, Vindra.
And Sharolan was supposed to ask a question.
Yes, she wanted to ask a question. Sharolan? Did Sharolan fall asleep there? She's lying in bed there, hugging her pillow.
Sharolan, can you hear her?
I believe the question would have been, okay, right. She wanted to know about glaucoma, the treatment, the hospital. She's from Tobago. The hospital does not do the test that shows the extent, and she's not getting on to the doctor at Calder Hall Medical Complex in Tobago. She wants to know what can she do.
Okay, so you've been diagnosed with glaucoma. So the test that part of your examination and the tests. First, your vision. That's the first thing. The second thing is the pressure in your eyes. Okay. The third thing is examining your eyes on the machine, on the slit lamp. So you must look at the nerve at the back of the eyes. Sometimes you can do it. It depends on the doctor, but sometimes you need drops to be put in the eyes to look at the back of the eyes. A field test and an OCT. Those are the things that must be done. All right. Field test and OCT. An OCT once a year, once you're controlled. Similarly for the field test, once you're under control. Okay. Sometimes you do a field test. It depends. You can do the OCT and field test more frequently if you're not under control. But those are the things that must be done to manage your glaucoma efficiently. Yeah.
Can you repeat the doctors in Tobago, because I know.
Dr. Sharma,
yes,
and Dr. Dwarka. Those are the two that I know for a fact working at the hospital in Scarborough.
Okay. Well, guys, I don't know if you have any more questions. If not, we have to let Dr. Bartholomew catch Aziz tomorrow. Dr. Bartholomew, what are you doing tomorrow?
But I'm not working. But I'm looking forward to but you know that I sing at church, so I have church in the evening. I am actually going to try to get my son a class in he's doing Spanish, so one more exam and that's orals.
Right.
But I'm more excited than him. I can't wait to maybe have a party. When I say a party, I mean a Zoom party, of course.
Yeah.
Yeah, I'm not doing anything. So it's emancipation, so I'm looking forward to dressing up. That's what I'm looking forward to doing. I'm seriously, I've been putting out, different outfits, and I might tie my hair for the first time or even put a flower or something, but I don't know. You know me. I like that. I like that kind of thing.
You and I are so similar in terms of we love to express ourselves through what we wear, and that gives me a sense of well-being by looking the part.
One thing I learned over the years. I used to be almost shamed for wanting to wear makeup, and I saw a post recently with someone, a guy saying that, I hope you women know that we don't care about eyelashes or makeup or whatever. And I said, who told you that we wear makeup for you? and I want, one of the things that I take away from this and something that you said, Rihanna, is that however you feel to express yourself, that makes you happy, do it.
Yeah.
I mean, it once it's within me, it's you. It doesn't involve anybody else, but it's you. Whether you feel like coloring your hair or you feel like once it's safe for you, it's not damaging your skin or whatever, do it. Because it's an expression of you.
Very much so. And I think that's why I wanted to continue the series, to really empower patients, because a lot of patients, they think that lupus is a death sentence, so they also feel somewhat robbed of their future. But, I want to encourage patients to, to glean from each other and empower each other and draw strength from each other, that you can thrive in spite of having lupus.
Yeah.
I've been going through a lot with my health, and then being stranded up here has not helped with my health It has not helped with my physical health as well. But, in spite of being locked up here in an apartment by myself, I still dress up when I know I'm coming to do these, these series, or having a presence online. I don't show or project how I feel or my current circumstances.
Yeah.
I project what I essentially want to experience in life, which is wellness and joy and happiness. And I do believe it's very important, even though you don't feel it and you don't see it, that you have that faith and you live that faith life, that, I'm going to create it. I don't have it, but I'm going to just muster the strength to create it, and I know that you have done that. You yourself, you're a walking, breathing testimony. You're a miracle. So, I'm just so happy and really grateful that, you were the first person I thought of. I reached out to you and you did not hesitate. You did not stick. You did not stutter. You did not stop. You just said, okay, when? And the last couple months I've been here, I have been really seeking after my mental health, because I was diagnosed with depression. I just really was in a bad place. And I had to evaluate what brought me joy. And what brings me joy really is, the work that I have been doing for the last 10 years with this community, as sometimes small and insignificant as it may sometimes be. It's empowering to know that your life can have a positive impact on someone.
That's right.
And your life has been very impactful on different levels, not only professional, but personally, and even through your art and your music, so I'm so honored, and I really wish I could give you a hug right now and just say thank you.
I receive it. I receive it. Yeah. I receive it.
From all of us, we thank you so much for being so, in depth and just doing what you have done to bring us in the know.
Thank you, Suzanne. It, especially in the Caribbean, it's hard for people to talk about mental health and mental well-being, and this lockdown has not made that navigation easier. I talk about especially the young people. They've had a lot to deal with, because as a young person, there are things that you appreciate, and that's how concrete your world is. How finite it is, in that that you'll get up in the morning, you have school, you have, and suddenly all of that is taken away, and you don't know what your future holds. And so all of that, plus the loneliness, all of those things, it's really been, I agree, it's been really tough, and it's not been easy on a lot of people. But for you to admit that takes a lot of strength. I hope you know that. But I've always admired your strength anyway. Ever when I first met you. And so I have a little surprise for you.
You do?
Yes. So 2013 was when I sang this song for you. Now I can't sing all of it because I don't know if my voice will allow, but I'm going to sing the first verse of it for you.
Oh my God.
This song I dedicated it to, the first time I ever sang it, I dedicated it to Rihanna, because when I first researched the song and started listening to this, she was the person that came to mind.
Oh my gosh.
All of these lines across my face tell you the story of who I am. So many stories of where I've been and how I got to where I am. But these stories don't mean anything when you've got no one to tell them to. It's true, I was made for you.
Oh, thank you very much. You sang that when I was in ICU, when I fell sick in 2017, and I laid in a hospital bed for weeks. after I came out, and I was just reading all the messages and the love I got from around the world. And I remember you dedicating that song for me, and it brought tears to my eyes, because when I first heard that song, you're gonna make me cry. Oh Lord. Yeah, listen, Debs, thank you very much. And I receive your love. Thank you for believing in even my own unique power to make a difference and standing with me here as we continue to empower patients and, continue your work. And may God give you strength and continue to give you those creative juices, that you would continue to create the impact you've been doing, not only just in as a medical doctor, creative mind, but even as an advocate. I know you've been doing so much now with your time to empower parents with children with autism, so I mean, you can also talk about that if you choose to, but I know you've been doing a lot. You've been personally affected. We've watched your son grow up before our eyes, who's a testimony that he's not a product of his circumstance. What an awesome story.
Thank you everyone for listening in. You guys have been awesome, and I really, really appreciate it. Kudos again to you, Rihanna, for doing this. This is the way forward. This is what we need to do. This is how we empower, we educate, and elevate, and then empower. So kudos to you and to everybody here. Keep inspiring by your journey. The journey that you walk is not for the faint of heart, and certainly you just by you taking one step at a time, you inspire so many people that you may not even know. I mean, I saw somebody who had a child next to them. You do not know how you are inspiring that little one. So just keep putting one foot in front of the other and inspiring generations to come.
Yes, thank you very much. Thank you. Well, guys, it has been a pleasure. Thank you for being a part of our official first series, Lupus and Our Eyes, facilitated by the wonderful Dr. Deborah Bartholomew. There is Us in Lupus, Take Charge. That's the educational series. And next week, hopefully, we will be hearing from one of the top nephrologists in Trinidad and Tobago, Dr. Sean Lynch, who has agreed to come on board. I believe he said his schedule seems clear on Thursday, so we just have to make sure he's confirmed. Dr. Lynch is very knowledgeable. He has done so much in research and also in treating and dealing with kidney disease and also lupus patients who are diagnosed with lupus nephritis. So we look forward to that, and we hope that you can come on board, and please extend the invitation to your family, your friends, your caregivers, your spouses, because there is us in lupus and we're all in this together. So from New York to Trinidad, all of you, all my love, we are signing off. And again, thank you, Dr. Bartholomew. All the best to all of you.
You're welcome.
Thank you so much. Bye.
You're welcome. Bye. And enjoy next week. Sean is awesome. Sean is absolutely awesome.
Yes.
So you will enjoy it. You'll learn a lot.
Yes, yes. Thank you. All right, guys. Bye.
Bye.